people with HIV and AIDS coming to America. I'm ashamed that it happened, that it was present when I was there, and I think they're right. And that's why we're going to get the International AIDS meeting here. I changed my position on needle exchange. I think it's the right. I think it'll save lives, and I think the thing that one of the things that at least we ought to do is maybe get the. As I remember, the Republican Congress went, and the president went. The then president took away the local option from the District of Columbia, or tried. Isn't that right? And I think that at a minimum, since a lot of these problems are highly concentrated in urban areas, if they don't want to fade this heat now, one of the things you might consider doing that I would strongly support is giving this decision back to the community AIDS networks and the local governments involved. And because I think there's no question what we do here in Harlem, there's no question what we do in most of New York City, no question what would happen in Washington, D.C., where we've got a terrible problem on our hands. And so I agree with you. I think this is a decision made by people who live in the areas where it's not a problem and people are queasy about drug use that affect the lives of people who live in areas where it is a problem. And if they don't want to come out and flat out endorse needle exchange, you ought to ask them to give it back and have a local option. And I think that a lot of our communities, our Harlem AIDS Clinic here, I think, you know, we could make a lot of good happen out of that.
I anticipated that there might be others who couldn't be restrained.
Well, if we do any more in America, we couldn't do it without adding that. What we're doing around the world is providing care for anybody that shows up that needs it, including men who have sex with men. Everywhere else, everywhere we work, we try to treat whoever needs the medicine to stay alive without discrimination and do outreach to all the populations that need it everywhere in the world we work. We have not been particularly active here in the United States, and one of the reasons I wanted to have this meeting today is that I think we all, not all of us, not the other panelists, but people like me who think we know and care a lot about this, got a little too casual about the problem sneaking back up on us in America and assuming dimensions that were not properly being managed. So the short answer to your question is, if I can figure out someplace we can make a contribution consistent with our obligations around the world, which are very large and include selling medicine in 70 countries and having public health networks in more than 30, yes, I would do that. And in other countries, we do that right now, and we should. Everybody should.
Can I just make the point and abuse the moderator's privilege for a moment to say that the mantra, the slogan for World AIDS Day this year is universal access, which meant full treatment, prevention, and care by the end of 2010, which is obviously not going to happen, and human rights. And one of the phenomenal moves backward that is presently occurring internationally on human rights is what is happening to men who have sex with men in Uganda in the light of a new bill, a private member's bill that's been introduced into the Parliament without the objection so far of the President or of his cabinet, so it is a proceeding apace. It's a bill which not only prescribes life imprisonment for anyone who's gay, but it also demands of everyone in the society, whether parent or teacher or doctor or nurse or civil society activist, whomever, if they suspect or know a person, man or woman, child, a boy or girl who may be gay, they are to report it to the authorities within 24 hours. And on top of that, any HIV-positive gay man who has sex with another gay person is subject to the death penalty. It's the most hideous erosion of human rights and speaks to the phenomenon that 77 countries in the world have sodomy, anti-gay laws, and 40 of those 53 countries are in the Commonwealth, and it is in fact becoming a very serious issue in the combat of AIDS in the concentrated epidemic among men who have sex with men. I've been given the signal for one final question. Can I ask each of you quickly to give a brief sense of where we should now go if we were speaking to young people in particular? What is the battleground? How do we wage this fight hereafter? Let's start with Kali, and we'll move across quickly.
I think that's, for me, really simply just love, access, and education. We would first have to teach people that there is love out there, there's opportunity out there for them, and that those individuals that are being lost to the system, that are being lost to our educational systems, that are being lost to poverty, that are being lost to homelessness because they've come out in their homes and have been ejected from their households and forced to face life on their own, like so many people that I found sitting outside of the Ruth Ellis drop-in center in Detroit, Michigan, who were 13 and 14 and outside at 4 o'clock in the morning without a roof over their heads because they came out to their parents. We have to establish a system of love in our country and adapt zero tolerance for any type of abuse or neglect to any children in this country. We have to provide comprehensive and appropriate education to our children so that they know how to compete in our global economy, but also so they have life skills so that they can take care of themselves in this world and in this country. And lastly, they have to have access to health. They have to have access to quality and affordable education, not only on the primary and secondary level, but they also have to have access to higher education to be competitive in this world. And finally, they have to have access to health care. With 50% of people not having access to health care in this country, 21% who don't know that they're infected, and 29% who have HIV, who just can't get access to the medications that will keep them alive. It's absolutely intolerable in this country, in the United States of America, and we have to do something about that today.
Thank you.
I agree. And I agree fully. And I would also say on the government side, we have to invest in prevention. I think roughly the budget now allows roughly about 4% toward prevention. And when we invest in prevention, to make sure that the resources are going to those areas and communities of greatest need so that we can do the outreach, we can provide the education, we can work with the women, the girls, men who have sex with men, and young gay men now who are also increasing, the numbers are increasing in terms of infection. So while we do the work on the treatment, the care, the housing, which is necessary and we must continue, but we must focus on what can we do on the prevention side so we can begin to keep the numbers down. And the best way I know, working through many of the faith and community-based organizations and partnering with health departments throughout the country and working with other groups who are focused on these kind of issues, outreach, education, getting people educated, getting people tested. We've got to do more in terms of getting people tested. Here in New York State, we're continuing to work to try to turn the public law around with respect to routine testing. We need to have routine testing and not have barriers to people getting routine testing. And of course, we have to look at something we've not said much about today, but I think we have to give much more attention, and that is the incarcerated population. As more people are being released from prisons, coming back into the communities, reestablishing relationships across the board, we must be concerned. I know Congresswoman Maxine Waters has some phenomenal legislation to address this. We need to get behind that legislation that will require testing going in and testing coming out. And lastly, I would say on behalf of the many clergy members who are working on these issues across the country, there's a very important piece of legislation, H.R. 1964, the National Black HIV/AIDS Elimination Act, that is designed to address much of what we are talking about here today. The disproportionate impact of HIV/AIDS within the black community, including MSMs, must be addressed by people who have the experience, have the knowledge, and have invested in making this legislation a reality. It's comprehensive, it's bold, and it touches upon all of the areas